Thank you for staying with us on Joy News Desk. Welcome back. And the Ghana Health Service in the Northeast region says it has begun an investigation into suspected waterborne diseases at the Bunbuazio community in the East Mamprasi municipality. The disease is believed to have caused the death of at least 5 people and many others being treated with intestinal infections. The deadly strange disease has been associated with the community's source of drinking water. We now hear from the health service shortly, but first a report by Ilyasu Tanko.
7-year-old Fatima Musa is one of the victims of this suspected waterborne disease. She returned from the Nalirgo Baptist Medical Center weeks ago after a successful intestinal surgery, and her parents say she's in stable condition. It started with her suddenly vomiting a yellowish liquid. It was so severe that at a point she could not stand on her feet by herself. We rushed her to the facility at Langbinsi and we were referred to the Baptist Medical Center in Nalirgu. As soon as we arrived, she was taken to see a doctor who examined her and said she drank a contaminated water. So the doctor told us to inform our assemblyman about the situation. This 6-year-old girl, Rukaya Musa, is another victim in the community, also discharged from the Nalirgo hospital days ago. Her mother, Aisha Musa, who was with her at the hospital, spoke to JoyNews. They put a tube through her stomach and brought out lots of yellowish liquid before the surgery. The doctor then told me that the water we drink in our community is harmful. JoyNews in the community gathered that about 5 people so far are believed to have died from the disease since 2019. Yahaya Tani is a wife to one of the disease patients, an 80-year-old man who died last month. He was complaining of stomach pain and was vomiting as well. So the children took him to hospital, but he died there. The outbreak area is the community of Bunbuazio, a farming settlement of about 1,000 people located near Langbinsi in the East Mamprasi municipality. With no good road, electricity, health posts, water and sanitation infrastructure, the people are in desperate need of basic amenities. The community has 2 main water sources, a stream that runs at the outskirts of the community and 2 boreholes. A 3rd borehole facility, which was to be constructed by this NGO, has since been abandoned. However, people rely on the water from the stream due to all the time very long queues to the borehole water. This pregnant woman has just walked past a borehole heading to collect water from the stream. Because the pipe water is not enough for all of us. We are suffering a lot to get water to drink. We are always at the hospital as our kids, husbands and relatives are getting sick. We are pleading with the government to give us good drinking water, else all of us will die soon. At the stream, dozens more women have abandoned the boreholes and were here with their young girls to collect the water. Kasim Amina is a teenage mother claiming to have lost one of her twins to the waterborne disease few weeks ago. The doctor told me the water we drink is contaminated. She wants authorities to come to their aid with clean drinking water. It is still not clear what could have contaminated the water leading to the deadly outbreak, but JoyNews found evidence of open defecation and other insanitary activities of the residents along the stream. We need the pipes to be situated at the back of our houses. We need it urgently to prevent further death. The assemblyman for the area, Bukari Baba, said he has filed a formal report inviting authorities at the East Mamprasi Municipal Assembly to investigate the outbreak.
The case really escalated this year. Last year, it wasn't like this. They were having it within themselves. Those who went to have that kind of diagnosis. They were having it to themselves. Just this year that it increased and the number has increased. Therefore, they can't hide it again. From what they are saying now, we have more than 15 or 20 people who have diagnosis the same sickness. The one who went the last 2 years, that was 2019, he died. One also said the child died. One child is just by my at the back of my house. He also died. They sent him 2 days and then they diagnosed that the sickness was from the intestines, and he died before they could do the operation.
So how many people have died?
They are about 5. One immediate thing I think they should do is to come and then test the water. If really the sickness is from the water, then the second backup, or they will give us a backup system, like getting us a borehole.
Ilyasu Tanko reporting.
Well, that is the plight of the members of this community. In response, the East Mamprusi Municipal Health Director, Mark Abugri, says a team has been dispatched to the community to investigate.
I immediately sent my men there to go and then find out what the situation is. And they have gone there. I'm yet to receive the report from them. And as part of the investigation process, when I get a report, we'll further make inquiries at the hospital where the people were said to have gone to get the real situation there before we'll be able to know what exactly we are dealing with. So one, I asked them to go and find out whether indeed those cases that were said to have emanated from their community are there. That is number one. And I've also asked them to try and get some information about the cases that we'll use to follow up at the hospital, to go and find out whether indeed they went to hospital and what was the diagnosis. I think that will let us know exactly what we are dealing with when we get the report.